According to a study in the United States in 2022, an estimated 40 to 60% of women under the age of 35 have uterine fibroids, while the rate is between 70 to 80% among women over the age of 50. In Trinidad and Tobago, uterine fibroids are a common health concern among women in their late 30s and above. Fibroids often go undiagnosed and can cause uncomfortable symptoms. But there are some myths about these growths. Fibroids may press against the bladder and cause urinary frequency or urgency. Some growths press against the rectum and make it difficult to have a bowel movement.
Misconceptions that fibroids are cancerous. They are actually benign. The prevalence of cancers associated with fibroids are not, they're not the highest. And so that's one misconception and fear that pervades where fibroids are concerned.
Fibroids can cause menstrual cycles to be heavier than normal or last longer than usual and can be very painful.
But if you have to change your pads very regularly, that's not normal. And when we say regularly, some women, even girls, you start doing things to cope. So you find yourself wearing menstrual products for maternity because of how heavy the bleeding is. You find yourself having to use adult briefs to reinforce so that you don't have the mishaps, right? The leakages because your pad overflows regularly. Heavy bleeding is not normal. The pain.
Uterine fibroids can vary significantly in size, from a few millimeters to over 20 centimeters in diameter. They are often categorized as small, medium, or large based on their size in centimeters.
Some persons may experience bulking because the fibroids grow. And so you can actually feel them in this belly area, the lower belly, the lower region, close to your pelvic region. Some women can look pregnant because of the size of fibroids. So they can be as small as a chenet or a plum, even smaller. They can get up to the size of a watermelon.
Treatment, including surgery, is typically considered when fibroids cause significant symptoms like heavy menstrual bleeding, pelvic pain, or pressure-related issues. Fibroids can sometimes contribute to infertility, but this isn't always the case.
And I want to be very delicate about it because there are fertility implications, but there is a misconception that fibroids absolutely impacts your ability to have children. So if you have fibroids, you can't have children, and that is a misconception.
Fibroid Awareness Trinidad and Tobago has a calendar of activities in Tobago in July in observance of Fibroid Awareness Month. On August 3rd, there is a free clinic where women can get free ultrasounds and free consultations. The organization also plans to take their outreach to Trinidad later in the year. Need more information? You can find Fibroid Awareness Trinidad and Tobago at www.ttconfidenceproject.org. And be sure to follow Fibroid Awareness Trinidad and Tobago on their social media pages on Facebook, Instagram, X, and LinkedIn. I'm Karen Cozier-Phillip with your TTT News Health Check.